everybody. I'm Catherine Graff. I work for the Department of Health in the Office of Immunization and Child Profile, and I am the School and Child Care Immunization Nurse Consultant, which is a mouthful. But I am part of a team. It's not just me who's there working on immunizations at the State Department of Health to support you guys in the work that you're doing on the ground with patients and students to get them fully immunized and protected from all those nasty diseases. We've got a health educator down there with the beard. Well, I guess they both have beards. Mike's our data exchange guy who also works on the school module and technology. Ariel on the bottom, she's our school module rollout person, so she's the expert on that. I'm in back. I won't introduce everybody. We got our data guru guy, though, Jeff with the big smile. He also plays Santa at Christmas, so he's awesome. There's a team of us here. So it's just me up here, but I'm backed up by a lot. There's a lot happening in immunizations right now. So probably you've heard, I hope you've heard about some of it happening. So I've got a lot to cover. I've got a lot of slides, so I'm going to go through them fairly quickly. I want to leave some time for questions at the end. And I also have my contact information at the end also. So, if we don't get time to questions, please email me, and I will do my best to answer your questions and make sure you've got the information you need going forward. So first I want to talk about changes. So the RCW and WAC changes to the immunization requirements. Talk a little bit about the different versions of the Certificate of Immunization Status. We're going to talk about exemptions in the COE. I want to talk a little bit, I'm not going to go into great deal of detail about the immunization requirements, but I just want to highlight a couple things around DTaP and Tdap, and then also polio vaccine, and then a little bit about the school module and some resources. So lots to kick off here. First of all, last spring, the state legislature, which was a surprise, we weren't anticipating this at the Department of Health, but they did pass a bill that removed the personal exemption option for the immunization requirements to be fully immunized against measles, mumps, and rubella. So only the religious and medical exemptions still apply to those three diseases for immunity. It also did something really interesting in Washington State in that it put in the first adult state mandate for vaccination. Up until now, there's been no vaccinations required for adults in state law. Healthcare providers need to be vaccinated, but that comes from OSHA and the federal kind of regulations around that. But state law, this is the first. And it requires all employees, all staff and volunteers at licensed child care centers, and that includes ECAP and Head Start preschools because they fall under that same umbrella. So all of those workers and volunteers have to be immunized either with one dose of MMR vaccine, which is what's recommended for adults, or they have to be able to demonstrate immunity either by titer or by history of disease or by virtue of their age to measles. So that's a very new requirement and has it's been an interesting rollout and implementation of that. So that was in the spring. In summer, the State Board of Health, which has the rulemaking authority for the administrative rules for the immunization requirements, they made some significant changes to the requirements for school and child care attendance. So they target, there's three main areas that are changing in the immunization rules. One is the documentation requirements is changing. The conditional status definitions have been tightened up to align with what the RCW and the law says. And then the Tdap requirements are changing, and that's as a result of the ACIP changes in the recommendations around Tdap vaccine. So I'm going to tackle the easiest one first, and that's Tdap. So up until the 2019 schedule, the ACIP, the Advisory Committee of Immunization Practices, which gives its recommendations to the CDC for the adult and adolescent and child immunization schedules, they changed from where they had said in the past when Tdap was first was first introduced, they had said that if a Tdap was administered at age 7 through 10 years of age, in a catch-up schedule or inadvertently or for whatever reason, that should count for the adolescent age 11, 12 dose. And then a couple of years later, they said, well, it may count, or you may want to give another dose when they turn 11. Well, 2019, they said you should give another dose at age 11. So what they're saying, what ACIP says now, if a child gets Tdap between 7 through 9 years of age, then that dose does not count for the age 11 Tdap booster. And they really want to make sure that those teenagers, as they're moving into their teen years, have some protection against pertussis that will help protect the younger siblings and other children at home. So they really want to boost that pertussis at that age. So we did some research into that. When they first were making this change, they said that would even include 10-year-olds, but they backed off on that. They said, okay, if you get it at age 10, it'll count. But you really should give it at 11. Don't give it at 10, but if you do, okay. So when we looked at that, it was going to impact about 50,000 students across the state, which is a pretty large impact for the change for students that we need to get another Tdap. So State Board of Health agreed to an implementation plan on the requirement changes. First change is we are going to move the Tdap requirement to grade 7 instead of starting at grade 6. That should decrease providers wanting to immunize early because of those summer birthdays, and some students actually don't turn 11 until they are in 6th grade because they start kindergarten early. So next school year, the 2021 school year, and all of these changes are about 2021. They're taking effect then. Students in 7th grade need to have a Tdap administered at age 10 or older. Doesn't matter if they had one before, they're going to need another one at age 10 and older. And then we're going to grandfather in the students in 8th through 12th grades so they can still meet the requirement with a Tdap at age 7 or older. And then we'll roll that up and out over the next few years. I did something there. There. Okay, so now let's talk a little bit about what the law says. The RCW around the immunization requirements says that on or before the first day of attendance, I've got that bolded because it's really important, all students must turn in documentation of either full immunization by vaccination for all of the diseases for which immunization is required, a completed certificate of exemption, or documentation of initiation toward a schedule of completion. And it's that last one that's going to impact, conditional status. Now, one of the major changes next year is that documentation of immunization, that first one that I just mentioned, is going to now be required to be medically verified records. Up until and through this school year, parents can just fill out a CIS and turn it into the school. Those are parent-reported immunization records. They're not necessarily medically verified. Parents usually try to do a really good job to give you accurate dates, but sometimes they don't. And so we want to align with what the standard is across the country. We were only one of 3 states that allowed parent-reported dates. So the standard is definitely for medically verified records. So this is going to impact all students, all new students that are starting at a school next school year. They're going to have medically verified records. Even your kindergartners that are enrolling right now for next school year, they have to have medically verified records. Okay, so it's not enrollment date, it's when they start. Now, the first bullet says even within the same district, so that would mean like students moving from elementary to middle school to high school. But I just want to say, since I sent these slides in a few weeks ago, our division leadership at DOH is actually working with OSPI and some other agencies to really look at the RCW WAC language and see if there's a way that we can maybe not have to do this within a school district for students that are already enrolled. So I anticipate more information coming about that part of the rule in February, mid to late February. We should have more guidance around that. So I can't say for sure which way that's going right now. And then for any student who's actually in school, but they need to turn in additional documentation, like your kiddos that are going to get their TDAPs and they need to turn it in, it has to be with medically verified records. You can't just have a parent call you up and say, yeah, you got his TDAP. It does not impact students that are in the school currently whose immunizations are up to date. I keep hitting this other thing over here. Okay, try that. Okay, so what does medically verified mean, right? Okay, so a CIS that's printed from the IIS is medically verified. Only medically verified immunization dates are supposed to be entered in the IIS, the Immunization Information System. So a CIS that comes out of that, that's medically verified. That includes the CIS that's printed from My IR, which is My Immunization Registry that parents can sign up for to get their own or their children's immunizations. If they're from out of state and they're not in the IIS or whatever, then if it's a hard copy CIS, it needs to be either validated with a healthcare provider's signature that's saying that the dates are correct, or if it can be validated by a school staff, a school nurse administrator, or designee. But those medically verified records have to be attached to the CIS so that that school staff person can look at them and see if they match and that they're real dates. Now, schools that are using the school module, because they're actually, and I'll talk more about the school module, which is it's a program within the IIS that schools can use to do their immunization tracking, using all of the data and all those immunization dates that are already in the IIS. So if they're using that, then they don't need to get a CIS from the parent. They just need to verify in the system that that student's immunizations are complete, and then make sure they get added to their student roster. If they need to add additional records into the IIS, they need to get medically verified records to be able to add those in to bring the student up to being complete, which is what they do now. So things that they can accept and things that you can accept as attached to a CIS, if the school staff is verifying it, can be provider records, anything that's printed out of an EHR, different provider records like that. Anything that comes from another state's immunization registry. Every state has an immunization registry and has a way that parents can request those records from the registry. It can be their lifetime immunization card, that you guys write on when they get a shot and you put the information on it. That's considered medically verified. And the school module training guide has additional examples of medically verified records. So conditional status. This is the one I was talking about that it's that on or before the first day of attendance. And if students are lacking immunizations, what does that mean for somebody who's in a catch-up schedule and is behind, and that initiation toward a schedule of completion? So the way that the rules were written had been interpreted to mean that students had currently 30 days from the first day of attendance to turn in their stuff. So to turn in their CIS, to turn in their COE. If they needed more shots, they had 30 days to go get some shots and turn in the information. Now, if they needed more shots, then they could continue to stay in school in conditional status until the next shot came due, and then they had 30 days to go get the shot and tell the school that they got the shot. It was kind of how it's been working in the last 10 plus years. That's not going to be the same for next school year. Next school year, in order for students to start school, their CIS or COE has to be at the school. There's no delay in turning in your paperwork. And if that CIS is not complete, so they aren't complete on their immunizations, they have to get all of the immunizations they are eligible to receive before they can start school. If they need more shots after that, then they can start in conditional status, wait till the next shot is due, etc. So they have to be up to date on their immunizations. That's a big change. So some examples, because kind of wrapping your head around what does that mean in a practical sense. So a child entering kindergarten has all of their early childhood vaccinations, but they're missing those age 4 to 6 recommended doses on the ACIP schedule. Those are required for kindergarten entrance, so they have to get their DTaP, their IPV, MMR and varicella. They have to get those doses before they can start kindergarten. And then they're complete, and they're not in conditional status. They're just in school. A student is entering 7th grade and hasn't had their Tdap booster. they need to get their Tdap booster before they start 7th grade. Again, if they need more doses, then they can be in conditional status, right? And the parent, if the student is going to be in conditional status, the parent has to acknowledge that on the CIS. The new CIS has a place for the parent to acknowledge that their child is starting in conditional immunization status and that they understand the timelines associated with that. So if they're really in conditional status, so here's some examples of that. A child is entering kindergarten and has had no vaccines, okay? They have to get one of each of the 5 that they're required to have to get started. Then they can start in conditional status. When the next one comes due, which would be the MMR, 28 days after the first dose, you can get the second dose. So when that next MMR, and then they have 30 days to go get the shot and turn in the paperwork. Or let's say a child is entering kindergarten, they've had all their vaccines except they just had dose 1 of MMR the day before school starts. They start in conditional status, wait till they can get the shot, and so forth. There's just a kind of a calendar picture to kind of play it out. So if school starts, so let's say that student got that first MMR, and we see MMR is due on the 28th of September. And the catch-up schedules for conditional status is the ACIP catch-up intervals. So it's the catch-up intervals that are in that schedule that we use for schools. And then they have 30 days after it comes due to turn that paperwork into the school. If they needed more doses, then it would continue on, right, until they were complete. Oh, I did it again. Must be touching something. But if that 30-day window expires and they haven't turned in their paperwork, they're considered out of compliance and by law have to be excluded from attending school. Now, there are some special situations that impact conditional status. First, we have McKinney-Vento and foster students. They must be enrolled regardless of their paperwork, including immunizations. I mean, that also includes other paperwork that's required for registration, like their birth certificate or other things. They have to be immediately enrolled in school. And McKinney-Vento students cannot be excluded for being out of compliance with the immunization requirements. Foster students can, but not McKinney-Vento. And then children of active duty military parents, they're covered under what's called the Interstate Military Compact. They are still required to have their paperwork at school on or before the first day of attendance, just like every other student. But if they are missing immunizations, then they have 30 days to get them done, according to the way that law is written. And that was specifically to protect students who are moving from state to state frequently. And like if they were moving from Washington to, say, I think Nevada has Hep A is required, they might need to get Hep A because it wasn't required here. So that kind of is for them. I don't know of any other state that doesn't have the same requirements we do. Some have more, but I don't think anybody has fewer requirements than we do. So we have been working really hard. There's a whole team of people working on these implementation changes at the Department of Health. And we're also working with other agencies to try and get this message out and get some resources put together. So we're working with OSPI, we're working with the Department of Children, Youth, and Families. We're working with the Principals Associations. We're working with the State Board of Education that covers private schools. I mean, we're really trying to make sure we're getting good, comprehensive info out. We do have a rule change website, and I have a link to that. It's also linked from our main school and child care immunization page, which I have the link later. And then we're also working on some sample parent letters. We've actually got those up. We've got a registrar and administrator letter, which should be going up maybe today. We're working on a registration checklist and maybe some other resources to go with that. We'll be doing some videos. So we're trying to get the message out. If you think of more things that would be helpful as you're thinking about implementing these changes, please let me know, because we're interested in trying to do whatever is helpful for you guys that we can. Okay, switching gears, the Certificate of Immunization Status Form. There are currently 4 versions of the form that are acceptable, okay? There's the validated form from the IIS, right? The one that says pass, fail, temporary. There's the CIS that's printed from my IR, and now there's 2 hard copy versions on the website. There's the one that's for this school year, and then there's the one for next school year that has the medically validated thing. So it makes it confusing, but it is what it is. The form has to be created by the Department of Health. You shouldn't be accepting substitutes, and we don't want the forms coming from EHRs. We want people to be using the actual forms. So the first one, the validated CIS, so, it's printed from the Immunization Information System. There's 3 places it's listed there where you can actually print it from on the system. It shows, like I said, pass, fail, temporary is the current language for the validation. And it assesses each child's immunization record based on school requirements by grade, because that's how they are, by grade, and then child care and preschool requirements by age, because that's how those are required. Okay, it's a picture of it. You probably have all seen that. I'm just curious, how many are like school nurses in the audience? Oh my, wow. And then clinic staff or other ambulatory staff? Cool, thanks, that's really helpful, thank you. Yeah, full hospital staff, woohoo, that's right, it's all good. Okay, so yeah, that's what the current CIS looks like. A couple of things just to note. So if chickenpox history has been entered into the IIS, it will print on the CIS. It'll print 2 different places depending on how it's entered. There's 2 ways it can be entered. It can either be entered with a chickenpox history button or by going into what's called special considerations with the provider side. If the word history or the date of disease is on the IIS, that is considered to be medically verified. Okay. The language, if you look a student up in the IIS, it'll say parent reported disease or something in there. It's the way it lists in the IIS, but that doesn't mean that it's not medically verified because it's a medical provider who's putting that information in to the IIS. So there's the 2 places you might see it printed. Same thing, documentation of immunity. For a while, the IIS had our software vendor had removed that capability to enter immunity by titer into the IIS. That is back, so providers can now go back and enter those immunity. And it's really, really important that information, if we're not vaccinating because they're immune by titer, that is really important for the schools using the school module because they need to have that information in there. So important to add. And this is how it would show as immune on the IIS. And the validation algorithms, they take these things into account when determining that pass-fail. We are working with a software vendor, already sent them our parameters and information to update the validated CIS to include the changes in the law and also the changes with the TDAP requirements because we're having to override ACIP for those 8th to 12th graders. So that takes some additional software. I'm also pushing really hard for a page 2 of the CIS that will print out and will list if they are still needing vaccinations. It'll list exactly what vaccinations they still need, which will tell you why there's a fail. And actually the language is going to change to complete, not complete instead of pass, fail. But anyway, so hoping for a page 2, and it will also on page 2 hopefully display any invalid vaccinations. So if an immunization data is invalid in the IIS because it was given at the wrong age or interval, if MMR doses are given too close together, for instance, then that one dose might be invalid. They don't print on the IIS and they're not factored in the algorithm because they're invalid, so they don't count. And so a lot of times that's a question. It's like, why is this dose not showing up? Well, because it's not a valid dose. And so it'll say that on page 2. So fingers crossed we get all of that. I'm pushing hard because I think it'll be super helpful. Now the MyIR CIS, MyIR is a whole separate thing. It pulls the dates from the IIS, but it's not the same software. Anyway, I'm not a software person. So it still is the old CIS before the validated CIS is what's in there. But it's still considered medically verified. So if a parent shows up with this, please accept it. It is medically verified. Hopefully we'll get them matched up in the future. And then here's some information about the flyers. You can print those MyIR flyers. We've really been encouraging parents to sign up. After the measles outbreak, we had a huge surge in people wanting to join up with MyIR. So you see at the beginning of the month, we were at 68,000. I'm sure it's more than that now. And that's just the parents. That doesn't include how many kids they might have, under them. And then you can also order those flyers as well. There's 2 ways for people to register. If they try self-registering and it doesn't work, like if you got a parent say, I tried, but it couldn't match me up for whatever reason, encourage them to try different phone numbers, because sometimes if dad's phone number is associated, now that we all have cell phones and different numbers, phone number can be an issue. Again, 2 copies of the hard copy CIS, the ones that are enrolling this year and ones for next year. So this is what the current one looks like. And this is what the new one looks like. Very similar. It still has the section where the healthcare provider can document history of chickenpox disease and can also document titer results. I do want to bring your attention to the polio. I don't know if you can read it. Polio is changing. So I'll talk a little bit more about polio in a little bit, but type 2, there's 3 types of poliovirus, type 1, 2, and 3. Type 2 was eradicated in the world in 2000, I don't have the date. Anyway, 2000 something. And then just last October, type 3 was eradicated. I mean, this is awesome. We are getting close to eradicating wild poliovirus. But because the main type of poliovirus that's circulating out there right now is vaccine-derived poliovirus type 2. So it is really important that our children be vaccinated against all 3 serotypes. And there is no way to determine immunity by titer to type 2, because once it was eradicated, just like smallpox, all of the samples of the virus have to leave the labs, right? And then they're warehoused and very tightly contained. We don't want it getting back out again. And they have to use in the lab, they have to use the virus to do the assay for the titer. So it's nearly impossible to get a titer for type 2 poliovirus in the lab. And it will soon be almost impossible for type 3. And CDC's recommendations is that we only consider students or children immune to polio if we can determine they're immune to all 3 types. So really it's only students who had immunity titers done years ago. Going forward, you won't be able to determine immunity by titer for polio. It just will be impossible. This is the section where the healthcare provider can sign the hard copy CIS to say that they validated them, or the school staff can do the same thing. But again, the school staff, for them to do that, those medically verified records have to be attached. There's 2 places where the parent can sign. I'll do questions at the end, so hold that. 2 places where parents can sign. The first one is for students that are using, for schools that are using the school module. So if records need to be entered into the school module, students coming from out of state or historical records that didn't make it into the school module, then the school has to have parent permission to do that based on the FERPA privacy laws. The second one is the place I was talking about where the parent acknowledges that their child is starting in conditional status. So that's only if the child is in conditional status do they need that signature. The back has instructions about all those things, including the conditional status. Okay, moving on to exemptions and the certificate of exemption. After the law changed around the MMR not having the personal exemption option anymore, we've had lots of questions about exemptions, and we did change the COE form and kind of separated the personal and religious exemptions just to kind of make that clearer. So a child can be exempted from one or more of the required immunizations. And to do that, the parent must turn in a completed certificate of exemption form. It's the Washington State Certificate of Exemption form. Exemption forms, letters, whatever from other states are not acceptable. It has to be the Washington form. So here's what the form looks like now. It's two-sided. There's the personal and religious section, there's a religious membership section, and then there's the part for medical exemptions. So there's 4 types of exemptions that are acceptable in Washington State. There's the personal, religious membership, and medical. Personal or philosophical is pretty straightforward. The parent has a personal or philosophical belief against vaccination, or that particular vaccine, whatever it is. Again, it cannot be used for measles, mumps, and rubella vaccine. The religious exemption is when the parent has a religious belief that's contrary to that vaccination. Now, there is no requirement in the law for parents to validate their personal or religious beliefs. So this is important. They are not required to do so. Some states, for religious exemptions, make the parents write a letter about what their religious exemption is, or their clergy member has to write a letter or something. We don't have that requirement in Washington. To have a personal or religious exemption, they have to sign the COE, the healthcare practitioner signs the COE, and they turn it into the school. That's it. So here's the 2 places, the place where the parent's going to sign, and then the place where the healthcare practitioner signs. Now, notice I used the word healthcare practitioner instead of healthcare provider. It's different. A healthcare practitioner is defined in this special part of the law that deals with exemptions. And a healthcare practitioner is a physician, so an MD or a DO. It's a naturopath, a physician's assistant, or an ARMP that's licensed in Washington State. Those are the only people that are allowed to sign the education or the medical exemption part of a COE. No massage therapists, no chiropractors. The healthcare practitioner is signing, and their signature states that they have provided the signator, which is the parent or guardian, with information about the benefits and risks of immunizations. That's what they're doing. And a healthcare practitioner who signs that in good faith is immune from civil liability for signing that. So they're saying, I've educated the parent, I've given them information. That's all they're saying on that form. Now, religious membership exemption. I get a lot of questions about this because people confuse it with religious exemption. I wish they had 2 separate names because the religious gets confusing. The religious membership exemption was added by the legislators when the education requirement was added to the exemptions in 2011. And it was added to protect the rights of those parents whose religious beliefs do not allow medical treatment by a healthcare practitioner. So they don't go to the doctor or their ARNP or those people that on that list for injury care, illness care, period. So it's against their beliefs to go to the doctor to get education about the benefits and risks of immunization. Okay, so they're saying we don't do medical treatment. So to do that, the parent has to sign that section of the form, that they're affirming that they belong to a religion that doesn't allow medical treatment. They don't have to provide any other proof. And they don't, the place where they had to list their religion has been removed because it was tempting to say, no, wait, that religion isn't valid, or they don't not allow medical treatment, right? We don't want people playing religion police. That's a really bad place to go. Religious rights are protected in our Bill of Rights, and we have to be really careful about what we do with those. So they are saying that they don't have any medical, that they don't accept medical treatment. If I'm a school nurse and that parent comes in with this in an EpiPen, I think I would be seriously questioning not the parent's religious beliefs, but that they go to the doctor. Because if they go to the doctor for other things besides immunizations, they can't use this one. They have to use the religious exemption that requires the signature. Make sense? Okay. Now, medical exemptions are granted by the healthcare practitioner. Those other exemptions are the ones that parents want. But a medical exemption, it's the healthcare practitioner's decision to grant this exemption. And they're doing it based upon their judgment that the vaccine is not advisable for the child. It's pretty broad in the law, their judgment, right? But there is guidance that we provide on the COE for the ACIP recommendations for contraindications, and also the vaccine manufacturer's package insert includes information. They can be permanent or temporary. If they're temporary, they have to have an expiration date. And if that date comes on a temporary one, then the child goes into conditional status for 30 days to either get the vaccine they're missing or get another exemption. This is what that section looks like. So the healthcare practitioner will indicate if they're not exempt, it's permanent or temporary, and if it's temporary, put in an expiration date on the form. A few considerations, frequently asked questions, if you will, and we do have CIS COE FAQs on the website, so that's a good resource too. So new forms should always be used. The newest form, the most recent form, should be used for all newly requested exemptions. But if a student has an existing exemption and a new form comes out, they do not have to go get a new exemption on the new form. So once they turn that form into the school, that stays, right? And if they transfer to a different school and they've got an exemption from school district A and they go to school district B, they can take that exemption form with them. The only time they'll need to do a new exemption form is if they're exempting, if the parent is exempting from a different one, vaccine requirement that is not already exempted. So if they're adding something. Now, if an exemption is no longer needed, so the student was exempt had a religious exemption for MMR, and now they've gotten both the doses. We really encourage you to take that exemption out of your student information system, or if you're using the school module, out of the school module. We consider that student now to be complete for that series, not exempt. When we're wanting to get stats on what's happening in schools as far as immunization coverage rates, we want to be able to determine risk, right? So if the student is really immunized, then we don't want to call them exempt. Okay, immunization requirements. ACIP has a much longer list of what is recommended on the child and adolescent schedule. And then on the right, you see what Washington State actually requires. So not everything recommended is required. This is the ACIP schedule. Now, if providers are immunizing based on the schedule, then the students are going to be up to date with their vaccinations. Just keeping in mind that 4 to 6 year old doses, they have to be before they start kindergarten. This is the vaccine required chart for preschool and child care. It is, as you can see, by age. And the way you determine how many doses are needed for different ages is you find the child's age, the row with the child's age that's closest to their age without going over, okay? So in this case, I've got by 19 months circled, and then nothing changes until they get to 7 years of age for child care. So all your preschool students would be this line, is where they need that. That by 7 years says by 7 years or kindergarten entry. Because once they start school, they're on the school chart. They're not in the preschool chart anymore. Oops, wrong way. And so this is the vaccine required chart for K-12, and it's by grade. And the grades are at the top, and the vaccines are in the rows. So you determine the child's grade, and then you apply those rules to what's needed for those grades. And you can see some are different. The rules are different in different grades. The back, I thought I had a picture of the back of the chart. Nope, I guess not. The back of the chart has additional details and information about some of those vaccine doses. But this is your go-to document. And if you take one thing out of this, besides the new rule changes, documentation and conditional status and TDAP, is to find this IVERS on the school and child care immunization page, bookmark the school and child care immunization page, and refer to this document anytime you've got questions about immunizations. It's a 20-some-odd page document that details all of the rules, the exceptions to the rules, the catch-up schedules for each of the vaccines that are required. So it's a very detailed document. So I get a lot of questions about the DTP family of series because it is a very complicated, especially if they start to get into catch-up schedules. So DTAP is licensed for children through 6 years of age. Okay, it contains more vaccine than Tdap. The capital letter indicates a larger amount of vaccine. So when you look at vaccines, you can see that. So DTAP is given through age 6. If students are in catch-up schedule for their primary DTAP series and they turn 7, they need to get a Tdap now, not a DTAP. And then if they need additional doses, they would get either a TD or ACIP says it's okay to give them another Tdap. Some clinics are just using Tdap now and not doing TD anymore. So that's okay with ACIP now. Again, the recommendation is 5 doses of DTAP with the last dose after the 4th birthday. But if they get their 4th dose after the 4th birthday and it's been at least 6 months since dose 3, then they don't have to have the 5th dose. That's one of the examples of the exceptions to the rules that's listed in that individual vaccine requirements, the IVERS document. And again, the Tdap rules are changing for next year. So students in 7th grade next year have to have a Tdap administered at 10 years of age or older. And students in 8th to 12th grade can meet the requirement with a Tdap as early as age 7. So they're grandfathered. MMR and varicella, another one I get lots of questions about. So MMR, varicella, 2 doses are required. Both doses have to be after the 1st birthday. And dose 2 has to be a minimum of 28 days after dose 1. Now, live vaccines, injected or intranasal live vaccines like MMR, varicella, MMRV, and FluMist, if they're not given on the same day, they have to be separated by a minimum of 28 days, and there's no 4-day grace period between different live vaccines there. So if they're, and the reasoning is because if they're given too close together, so if I get an MMR and a week later you give a varicella, the body's immune response, because this is a live attenuated vaccine, their body's immune response to the MMR will inhibit the immune response to the varicella. And so the body's not going to produce sufficient antibodies to provide immunity. So that's why it interferes with the second vaccine. Now, polio used to be pretty straightforward, but it has gotten complicated. So the rules are different depending on when the last dose was given, the grade that the student is in. It changes. So for all students, they have to have dose 1 at least at 6 weeks of age. Dose 1, 2, and 3 have to be a minimum of 4 weeks apart. And just like DTAP, if they get the 4th dose after their 4th birthday, the 3rd dose after the 4th birthday, they won't need a 4th dose as long as the minimum interval from the previous dose is met. Now, for grades K through 9, this is about next school year, they have to adhere to the August 7th, 2009 rule when the ACIP changed its recommendations. And when they did this, they did not recommend students that had been children that had been previously immunized being re-immunized. So those rules and this 8709 date change for that last dose of their polio vaccine. And this 080709 date is programmed into the IIS because that is part of the ACIP recommendations. So if they got their last dose after that August 7th date, it has to be after the 4th birthday, and a minimum of 6 months have to separate it from the previous dose. Grades 10 through 12, they don't have to meet that rule. So they can get dose 4 before the 4th birthday and only 4 weeks after dose 3. Providers can, if you've got a child in a catch-up schedule, it's okay to wait the 6 months between the 2 doses because that's the current recommended schedule for those students in those grades, but they don't have to. Oral poliovirus. So we use IPV in the United States. That's inactivated, right? It contains a vaccine for all 3 types of poliovirus. Okay, 2015, that's when polio type 2 was eradicated. And then, like I said, type 3 just in 2019. But because, like I said, we have a vaccine-derived poliovirus circulating in parts of the world, the World Health Organization coordinated a massive switch. They called it the Big Switch. On April 1st of 2016, all doses of OPV will only contain type 1 and type 3 vaccine. They no longer contain the vaccine for type 2. And that's because we want to stop that circulation of vaccine-derived poliovirus too. But again, IPV protects against all three, and the ACIP, which our state's rules follow by law, we follow the ACIP. And so the ACIP says polio vaccine, oral polio vaccine administered after April 1st, 2016 does not count in the U.S. schedule. So those doses do not contain all three types, and so that's an invalid dose. If without those doses they're not complete, then they need IPV doses until they've finished their schedule. Now, when this change made in the IVers, we did not say that as school nurses you need to go back and look at all of your records to see about OPV doses before that date. We're not saying you have to do record review, but as you get new records coming in with newly enrolling students, you want to apply this rule. And again, big plug for the IVers. Okay, school module rollout. I mentioned that a little bit. So the school module, like I said, it's a part of the IIS. It's a kind of its own separate. It has like the demographic records, the student's name, address. Well, the name is in the IIS already, but their address, their school, their grade, all that stuff is kept in its own section, separate from the main part of the IIS. But it uses the immunization information that's in the IIS to determine whether students are in compliance. It also allows the user, the school module user, instead of just being able to view the records and print a CIS, they can actually enter either new patients in the system for students moving in from out of state, or they can enter immunizations that are missing in the IIS, as long as they've got medically verified records to enter them from, because we never want parent-reported dates in the system. There's some benefits for schools in that it uses all of that data that's in the IIS already, instead of having to put it into the separate student information system. It uses the algorithms that are built into the IIS to determine compliance, rather than that having to be done separately in student information systems. Eliminates the need to submit the annual immunization report. Because we have access to the data from the back end, we can run compliance from the back end. So school modules, schools don't have to turn in that November 1st, this year it was December 1st report. And for the state, it helps us with getting more complete data into the IIS, reduces unnecessary immunizations. It really is the gold standard in reporting, because it has fewer errors for sure. And it gives us some really good, robust immunizations information statewide. And then what's not listed on here, which I think is a really valuable key, is it provides a lifelong record for that student. What's in your student information system, when they graduate, you give them back their CIS, but they might lose that and whatever happens. And now they want to go be a nurse. And they have to show their vaccine history, and they're calling me saying, how can I find my vaccine history? And I'm like, call your doctor. Because if they're not in, so if it's in the IIS, they can sign up to My IR, they can get their own records. Resources. So school module has a whole page that's dedicated. It's kind of like a rollout toolkit in a way. It's got a lot of resources for signing on to the school module. And there's a school module email that Ariel pretty much mans, and then she flags things for me from time to time. School and child care immunization page. This is one I really want you to bookmark and refer to it rather than just printing things off, because when we update things, they're always going to be here. One of the next things we'll be working on is the immunization manual. We just posted the new CIS. We just posted a new COE. We're posting other resources. So this is always your most up-to-date information. And if you've got questions or feedback, anything about the school and childcare requirements, that email right there, oicpschools@doh.wa.gov, is probably your best email. I monitor that, so do several other people, depending on the type of questions that come in. We kind of triage it out as to who answers what. But, you can always email me too, but if I'm out, like today or on vacation or something, then you might get a lag time, whereas that one's always going to be manned. And then finally, I do have a school and childcare listserv that we keep with GovDelivery. So you can sign up. There's a separate one for childcare immunizations and then one for school immunizations. And that's where I will push information out. So like when we just released the new CIS, I just sent an email last week out on that and giving information and the links and that stuff. And with all the changes going on with the rule changes, it might be good to sign up, and that way you're always in the know. I try not to send out stuff too often because I don't want to inundate you, so it's not like you're getting a weekly email from me. But it is another way to stay on top of things. And then questions. I don't know what time. Oh, good, we got 10 minutes. And I think there's a mic that has to be used.
So you were saying that the records that parents have that are handwritten, that are signed by a nurse or whoever, the little books that they have with the signatures,
Yes.
those are considered medical records.
Yes, those are considered medically verified because they're filled out at the time they get their immunization by the clinic nurse or the MA, whoever is administering that immunization.
So we can just copy that and
Yes.
attach it to the CIS, and that's the medical record.
Yes.
Okay.
Yes.
Catherine, are school nurses going to have the ability to enter titers? It's really problematic.
It's something, so with the school module, like I said, it's really important that titers are in the system. So for those of you who do work at the provider end, please enter those titers. School module users, they don't have that capability right now in the school module to enter them. So if they're not entered by providers, they get sent to our office and then we enter them. And we had a backlog, but I think we're on top of it now. Because the functionality was gone for several months, so the pile of titers was growing. But we do have somebody dedicated to doing that work now and entering them. And it's certainly something I've already brought up with our software company, that school nurses need a way to be able to document immunity in the school module.
Hi. So you said foster students get immediate enrollment regardless of vaccine status. Do they get 30 days conditional status? What is their exclusion period?
So they would fall into that, yes, they would, their exclusion period would be kind of that 30 days would make sense.
And one more question. For the religious membership, if you've received that on a student and then you get like an EpiPen or a doctor note, do you send a 30-day overdue and ask for a certificate of exemption for religious? Like, how do you handle that?
I think for me, when I was a school nurse, I would handle that by contacting the parent, like directly, calling them, saying, hey, your exemption says that you don't have medical treatment, but now you just brought me this EpiPen or inhaler, or
Yes.
your child's got a cast on. And then it's a matter of educating the parent about what that religious membership exemption says. And one of the asks that we had from some school nurses was that we have kind of a handout. So on our website, there is like a fact sheet, an exemption fact sheet that talks about all 4 kinds, and it's meant to be able to give to parents and say, this doesn't really apply to you because your child's going to the doctor. So if you want to have an exemption, you need a different kind.
We have a question on webinar real quick.
I have 2 questions. So the first question was, can you address foreign immunization records? And then the second one was, the person lives in Montana, and does any of this information relate to other states? Are other states doing the same thing that Washington's doing?
So foreign immunization records can often be really difficult to decipher. I won't tell you that that's not true. It's the same for schools and it is for providers, and they're tricky. And there really isn't a lot of great guidance with foreign records. but you can kind of tell. And what is a medically verified record is left up to your nursing judgment. And that's true of the school module as well, when we've talked about that. It ultimately falls to you to kind of look at that and say, does this make sense? Does this look like some kind of a foreign immunization record that would kind of be like something from a doctor's printout or like their lifetime immunization record? They kind of follow these patterns. You can usually tell, not always. So you have to use your judgment in those cases. As far as translating them, that's tricky. And I sometimes defer to, when I'm looking at records, I'll defer to the vaccine information statements that are required to be given out every time a child gets a vaccine. They're translated on the Immunization Action Coalition website into a ton of languages. And so it's a really good way to at least get the name of the vaccine and the name of the disease in that language. So sometimes I've used that to help, but it's hard. As far as what's happening in other states, so like I said, we are currently, but that's changing August 1st, one of only 3 states that allows parent-reported. Other states require some kind of medical verification, either a doctor's signature or the record has to come from the doctor's office, or some require it to come from their state immunization information system. So though it varies, the requirements state to state, but what I can tell you is that an immunization record from another school, even out of state, is not considered medically verified because we don't know when their rules took effect. So we don't know whether those records that were given to the school were parent or medically verified. So we want to not use school records.
My question was actually about the religious membership. I do have a file that everybody seemed to get onto the religion. With the MMR personal exemptions, everybody's suddenly religious in high schools. And I have one that is a religious membership, along with, there's a note in that same file excusing a child from PE from a medical provider. We can't kick them out. I mean, we can give them information, but we can't say you're not compliant, correct?
Yeah, I mean, I wouldn't want to take that stand, not without getting your administrator support and everything else, because you don't want to put yourself and your school liable for being sued, right?
Exactly.
Right.
So
But-
is there any talk about getting rid of religious and personal exemptions altogether? Like, what is it, California has done that? Hasn't California
So
done that?
I can tell you that what I've heard from state legislators that did this MMR thing is they're watching it, and they're going to be really curious about our results and to see what happened to MMR. And it's really cool, like with our school module data, because we have much more granular, detailed data, we can actually determine, like those students that did have an exemption before, what happened to them. Did they come into compliance? Did they get a different type of exemption? Did they just withdraw? So it'll be really interesting to see. I can't predict the future. I haven't heard any buzz about exemptions changing at this
But
point.
isn't that correct? California doesn't accept
California has
exemptions,
gone
other
to
than
just medical exemptions, and New York just did the same thing. And New Jersey is working on it. I mean, there's a movement, and AAP and a lot more medical organizations their recommendation is to only have medical exemptions for school.
Going back to the international records, so my understanding is that you need a healthcare provider signature or a clinic stamp is what it says on the back of the CIS form. So you get something from a foreign country that has no healthcare provider signature, no stamp on it. That's not valid, I would think.
So a stamp or logo is what it says. So it doesn't have to be like a physical stamp, because like something comes out of an electronic health record from a clinic down the street, right? It has that logo or that information on it. So if it looks like an official immunization record, if looks like an official record, then I would want to accept that.
Okay, so
Right.
it does not need to have.
Yeah, I wouldn't go that far. Again, you kind of use your judgment to say, does this look official, or is this like something a parent just wrote on a piece of paper and handed me, right?
Got it. Okay, thank you.
Last question over there.
Oh, okay, last question.
Okay, so I have 2 questions, if I could. Yes. So could you clarify on the McKinney-Vento students? So I understand that they don't need to have that requirement upon entering school. Do they ever need a requirement? They don't have 30 days, they don't have anything? We never ask them for it? What do we do?
we definitely want to ask for it, right?
But I mean, if they
And the
don't
way,
have it, they just.
so for
what do
McKinney
they-
Vento students, the way it's written in the federal law, it says that the homeless liaison should be working to get them either immunized or get their records. So somebody should be actively working with that family to try and get their immunization records.
Right.
For that homeless student. So we don't just want to say, okay, never mind, we don't want to do anything with you. But they enter school, and they'd actually would enter school being out of compliance because they're not officially in conditional status, right? But we cannot exclude them for being out of compliance. So their status, so if you're reporting on those students, you would report them as out of compliance, but you do not exclude them.
Okay,
So-
so then there's no, I don't want to say pressure, but there's no.
There's no end date, there's no further enforcement for those
And they don't have to
students.
feel the need to go. That's what we come up, because there's nothing we can do, so there's no, okay, but we certainly help them.
Yes.
And then, sorry, but I was trying to take notes, and you had one slide there that said on or before the first day of school, they have to be fully immunized, medically verified, completed COE, and there was a third thing, and I missed
The
that.
third
So-
thing is have documentation of an implementation of a schedule toward completion. So those are those students that are in a catch-up schedule. And to do that, they have to have at least one dose, they have to have those doses that they can get today before they can start. So, I will be at the resource table later, and so if you have questions, come find me.
Yes, thank you so much.
Thanks.